Hello, my name is Sarah Mooney. I'm the orthopaedic nurse specialist here in the Hermitage Medical Clinic, and I'd like to welcome you to Joint School. I'll be discussing your inpatient stay, your pain management, your day-to-day procedures, and your discharge criteria and your follow-up. I will also discuss potential complications that can arise from having orthopaedic surgery. To begin with, I'd like to discuss pain management. Pain management is essential for your progress and your rehabilitation after your surgery. As you probably already know, orthopaedic surgery can be quite painful, so pain management is essential to have optimal rehabilitation. We will work with your consultant, your anaesthetist, and yourself to make sure that your pain is well managed during your inpatient stay. To assess your pain, we use a numeric pain scale, 10 being the worst, 0 being the best. We ask you to score when you're communicating with the nursing staff about your pain relief. We will administer pain relief according to your pain score, so we encourage you to be as accurate as possible. Cryotherapy is also a device that we will be using. Cryotherapy is a blue sleeve that will be attached to your joint. It's filled with ice water, and we will use it for 20 minutes at a time. We will encourage you to use the cryotherapy on a regular basis, especially after your physiotherapy. You will be admitted on the morning of your surgery 2 hours beforehand. We will ask you to fast for 6 hours prior to your admission time, 8 hours prior to your surgery time. The nursing staff in the pre-assessment clinic will have discussed what medication to take and what not to take during this period. If you have any questions, you're encouraged to ask the nursing staff on your admission. The morning of your admission, when you're admitted to the hospital, you will attend main reception. Admission staff will admit you, create a chart for you and guide you upstairs to the main ward, where you'll be seen by a doctor and a nurse, and you will be admitted to the ward. 2 hours after your admission time, you will be taken down to Holden Bay in the operating theatre, where you'll meet your consultant and sign your consent. You will also meet your anaesthetist, who will discuss your pain options and your anaesthetic. After this, you will proceed for your surgery. Once your surgery is over, you will wake up in the recovery room. The nursing staff here will be monitoring your vital signs to ensure that you're stable. They'll be monitoring your pain relief and monitoring your sensation in your lower limbs due to the spinal anaesthetic. Once you're deemed fit and stable, you will return to the ward with the nursing staff. On return to the ward, the nursing staff will check your vital signs. They'll give you something to eat, such as tea and toast, and they'll encourage you to eat and drink throughout the evening. Due to the type of anaesthetic you have, we would encourage you to do that. It's quite common to become dehydrated after your surgery. Depending on your consultant, you may be mobilised that evening, or you may be mobilised the following morning. You will be remaining in bed until the physiotherapist deem you fit to be mobilised. Following morning, the physiotherapist will assess you to ensure that you're stable for mobilisation. They will come in and check your vital signs and proceed with your physiotherapy sessions. They will also give you exercises to do. Once you've completed your exercises with the physiotherapy, the nursing staff will give you a hand to get up and get dressed. We'd encourage you not to have a shower on day one. This is because you're at risk of fainting, so we will encourage you to have a wash, brush your teeth, and maybe go for a walk with assistance. During this time, we'd encourage you to take any pain relief that is needed and to communicate well with nursing staff in relation to your pain score. If your pain is not well controlled, it will delay your rehab and prolong your inpatient stay. Day 2 is quite similar to day 1 in the fact that you'll be having physiotherapy again regularly. You will see your consultant. On day 2, we'll have a good idea of when you will be fit for discharge. Your consultant, myself, and the physiotherapy department will discuss your care and decide when you're suitable to go home. We encourage people to go home once you've met your discharge criteria. The consultant will not encourage you to stay any longer than needed. You recover faster and better and safer at home. On discharge, we would encourage you to have plans made prior to your admission. We will ask you, if you have nobody at home, to consider going to convalescence or make alternative arrangements to stay with a relative or a friend. Convalescence centres details are available from myself or from the pre-assessment clinic. A wide variety of convalescence centres are available. They can be close to your home or it can be a local rehabilitation centre. Don't hesitate to ask for the details. There are a couple of things we need to discuss for your discharge. Number 1 is wound care. You may have sutures, clips or dissolvable sutures on your wound. You may attend your GP or your consultant 2 weeks after your surgery to have your wound checked and have your sutures or clips removed. We would ask you not to change your dressing unless absolutely necessary. Every time you change your dressing, there's a potential to introduce bacteria. Unless your dressing becomes wet or starts to fall off, do not change the dressing. If you must take the dressing down, wash and dry your hands thoroughly. Then take the dressing down, immediately put on the fresh dressing. We would ask you to monitor your wound for any signs of infection. Do not disturb the dressing to do this. So the signs of infection are redness, pain, stinging, and swelling. If you are concerned and feel like your wound might be infected, contact your GP or your consultant or myself here in the Hermitage. Pain management is the second thing I'd like to discuss on discharge. We will give you a discharge prescription. We will give you regular and breakthrough medication. We will ask you to take them regularly until you feel like you no longer need them. If you don't feel like your pain management is adequate, please contact myself here in the Hermitage, the nursing staff on St. Luke's ward, or contact your consultant directly. We will organise an alternative prescription. We ask you to restart any medication you came in on. We will give you a discharge prescription. Your normal medication will not be on this prescription, so just carry on taking what you were on prior to your admission. We will be starting you on aspirin on discharge. This is to prevent blood clots. Blood clots are a potential complication of orthopaedic surgery, and the aspirin will aid us in preventing these. We encourage you to rest between your physiotherapy sessions when you go home. We also encourage you to use the cryocuff. This will help with the pain and swelling once you are discharged. Due to the nature of your surgery and the pain relief we discharge you home on, you are considered a high risk of falling. This is the same when you go home. We would ask you to wear good footwear and use your walking aids until you feel safe enough not to, or until your consultant or your physiotherapist tell you no longer need them. I would also like to discuss post-operative swelling. Post-operative swelling is common after orthopaedic surgery. You've had major surgery on a joint. Swelling and bruising is to be expected. This swelling may track all the way down to your ankle. Your leg will go black and blue for a few days, but it will subside. This can take up to 2 weeks. Your legs also will become swollen. We would ask you to rest in between your physiotherapy sessions and use your cryotherapy to prevent this. When you're sitting down, have your feet up on a low stool or rest on your bed. This will aid in preventing the swelling. If you have concerns about the swelling and the bruising in your leg, please contact myself here in the Hermitage or contact your consultant in his suite. If you have any concerns in general, I would ask you to contact St. Luke's ward on 01 645 9321 or myself, Sarah Mooney, on 01 645 9373. Alternatively, you can contact your consultant or his secretary. I would like to take this opportunity to thank you for participating in Joint School, and I look forward to seeing you in the near future.